like to introduce Dr. Sophia Rahman, who is a radiation oncologist, and she's going to explain about radiation for prostate cancer treatment.
Good evening, everybody. My name is Dr. Sophia Rahman. I am a radiation oncologist at Diablo Valley Oncology. And my goal today is to give you guys an overview of some of the different radiation treatment options that are available today in the modern era. So first of all, what is radiation therapy? So radiation refers to high energy X-rays that are used to kill tumor cells. And there are two broad categories of radiation therapy. The first is external beam radiation, which basically means that the source of the radiation sits outside of the patient, and the radiation beams are directed from the outside toward the target. The second category of radiation is internal radiation therapy, or brachytherapy. And what that means is that the source of the radiation is actually placed inside the patient in the area that needs to be targeted, and the radiation beams are therefore emitted from the inside out. Now, how does radiation actually kill cells? So this image that's up here shows how it does that, and it does that by two mechanisms. The first, the radiation can actually directly break the DNA. And the second mechanism is that the radiation can actually interact with molecules in the vicinity of the prostate and generate free radicals that then can cause damage to the DNA in an indirect fashion. Now, tumor cells are defective, so they lack the capacity to be able to repair this damage to the DNA, and so those cells die. And the dead cells are then eliminated by your body's natural processes. So external beam radiation is perhaps the most common radiation treatment for prostate cancer. A standard course of external beam radiation for an intact prostate is 44 daily treatments. They're done Monday through Friday. Each treatment takes about 20 to 25 minutes. So this is about close to 9 weeks of daily treatment. The most common technique for radiation delivery and planning is known as IMRT, or intensity modulated radiation therapy. And what that means is that the radiation beams come from various different directions and angles from all around the body. And in addition to being able to shape those individual beams, we're also able to vary the intensity of each beam. And this allows us to maximize the dose to the prostate and minimize dose to the surrounding normal tissues. A variation of IMRT is known as volumetric modulated arc therapy, and that's what we use most commonly at our center. And what that means is that we use a single continuous beam that rotates around the body and delivers all of the radiation in a single rotation. This allows us to deliver the treatments very quickly in a matter of just minutes. Side effects of external beam radiation include urinary frequency, urgency, like you have to find the bathroom really fast, diarrhea, rectal irritation, and fatigue. Long-term side effects can include erectile dysfunction, and it's reported that 50% of men report some diminished sexual function at about 2 years after the radiation treatments are completed. A small percentage of patients may also experience some chronic irritative bladder or rectal issues. It's not very common, but it can happen. And also, there's a very small risk of urethral strictures. Urethral strictures develop because of scar tissue formation in the urethra, which is the pipe that you urinate through. And if that happens and it's symptomatic, a urologist may have to go in and kind of open up that pipe. Now, one of the issues that we have with external beam radiation is prostate motion management. So we know that day to day, the prostate gland can actually move by 1 to 2 centimeters. And this can create a risk for a geographic miss. We're basically chasing a moving target. The reason why the prostate can move by that amount is usually due to variations in bladder or rectal filling. So if the rectum or bladder are very full, the prostate can shift. And so there are various techniques that allow us to control prostate motion or verify the position of the prostate. So there are techniques known as image-guided radiation therapy that allow us to monitor prostate motion in between the day-to-day treatments. There's various ways of doing image-guided radiation therapy. Some centers will use ultrasound, and patients will get an ultrasound before each daily fraction of radiation to verify the prostate position. Some places will place fiducial markers, and those are basically metal seeds that are implanted into the prostate gland and are imaged prior to each daily radiation treatment. Another form of image-guided radiation that we have at our center is cone beam CT. And what that is it's a low-dose CT scan that's actually built into our treatment machines. And prior to each daily treatment, we can get an image to verify the prostate position and the patient setup. So all of the techniques that I mentioned just now, they allow us to monitor prostate motion in between the treatments, so from day to day. But there's another issue that is at hand, which is prostate motion during the actual treatment, so while the patient's on the table. Studies have shown that while the patient is actually being treated, the prostate gland can move by up to 5 millimeters. And we're fortunate to have one of the latest technologies that allows us to control that, which is the Calypso 4D localization system. The Calypso technology is basically like a GPS for the body. It involves the placement of 3 tiny electromagnetic transponders, which are about the size of a grain of rice. And these are implanted into the prostate gland under ultrasound guidance by the urologist. And they allow for continuous tracking in real time while the patient's actually on the table to verify that we're on target during each treatment. There was a study that was published a few years ago that actually showed that the Calypso technology allows for a significant reduction in the risk of urinary, rectal, and sexual treatment-related side effects. So prostate brachytherapy. So this is the internal radiation that I had mentioned earlier. Prostate brachytherapy may be used for carefully selected patients, and it's important to talk to your urologist or talk to your radiation oncologist about the different options and to see if you're a candidate for prostate brachytherapy. So most of these brachytherapy procedures are done in the operating room under some form of anesthesia. So it can be general, spinal anesthesia, or even simply conscious sedation. There are two big categories of prostate brachytherapy. The first is low dose rate brachytherapy, and that involves the placement of anywhere between 60 to 100 tiny radioactive seeds that are placed into the prostate gland permanently using needles that are inserted through the skin of the perineum. That's the skin that sits in between the scrotum and the rectum. These seeds are placed evenly throughout the prostate gland, and they emit radiation over several months. There is another type of prostate brachytherapy known as high-dose radiation. And it's a similar procedure, but it involves the placement of hollow needles into the prostate glands, and these hollow needles contain a central catheter. After the needles are placed, the needles and the catheters are placed, the needles are actually removed, so only the catheters are hanging out. And the radiation oncologist can then place some radioactive isotopes into that catheter and allow them to sit there for anywhere between 5 to 15 minutes. So they dwell in there for about 5 to 15 minutes, and then those radioactive seeds are removed. This procedure can be repeated anywhere between 2 to 4 times. Side effects from prostate brachytherapy are very similar to external beam radiation side effects, with the exception of urinary and obstructive urinary side effects. Those can be worse.